One of the most frustrating aspects of the United States coronavirus response has been the lack of any explicit goalposts. There are really only 3 long-term plans for dealing with coronavirus. The first plan, the one we were using when we shut down in March, was to flatten the curve. We needed to reach the backside of this pandemic and achieve herd immunity without overrunning our hospitals. The goal was not to be Italy or 1918 Philadelphia when dealing with the Spanish flu. The goal was to be 1918 St. Louis, who locked down fast and hard and kept their caseload below what their hospitals could handle until enough people had been infected and recovered to end the outbreak. But with the exception of New York and New Jersey, the rest of the United States locked down faster and harder than St. Louis and on a much larger scale. Many cities locked down without a single coronavirus case, and as a result, 2 weeks later, many had seen hardly any coronavirus at all. Even the U.S. average that included the hotspots was barely visible when plotted on the same graph that included the St. Louis outbreak curve. This should have been a clue that we reacted too quickly. Most places could have opened up their economies in early April and used mild social distancing measures to get through the outbreak, only locking down again in localized areas if hotspots started to emerge. But that's not what happened. Instead, many states doubled down, adding new arbitrary rules. The cruelest and most ridiculous of these showed up a month into the outbreak as if we were trying to stamp out every last coronavirus case. The media supported all this by keeping a running score of who could have the strictest lockdown and the lowest coronavirus case count. They still framed all this as if it had something to do with flattening the curve, but with only a tiny fraction of a percent of the population getting sick each week, it seemed more like they were trying to eradicate every last case of coronavirus. But eradicating coronavirus is impossible. This would require stopping every single retransmission of coronavirus on the entire planet. I consider this plan to be a straw man, so I'm not going to spend much more time attacking it, but I have encountered real people who believe that this is the plan that we're on. Even if we could eradicate coronavirus in the United States, we'd have to shutter the border until every other country in the world had done the same. Plan number 3 is to hold out for a vaccine. This is not the plan that we were sold in March, and this does not appear to be the plan that we're on, but it is the plan a lot of people seem to think we're on. A vaccine may still be a year away. Most people agree that strict lockdowns for that period of time are unsustainable. So if you're a supporter of Plan 3, you need to identify how society continues to function under those conditions. Now it's May, and we're opening back up with more coronavirus cases than we had when we shut down. It's clear at this point that we are no longer holding out for a vaccine, and public health officials are confirming this by continuing to talk about flattening the curve and hospital utilization. But at the same time, they're tearing temporary hospitals down and advocating for the closure of college classes through fall. It's all very confusing. These moves only make sense if the goal is to keep every last person from catching coronavirus, including very low-risk 18-year-olds living together on college campuses. If we really are trying to flatten the curve, then public health officials need to tell us how many of us are going to get sick and how quickly this can and should happen to put this pandemic behind us. We need to know how soon or how long before things will be back to normal. But I don't think we're really on a flatten the curve plan. I think we're on a plan 4, which is to keep people locked down for as long as politically viable, and then drag this on indefinitely through a series of mandatory authoritarian decrees in the name of fighting coronavirus. We are told if we don't comply with these decrees that we'll lock down again, but we don't have a threshold number of cases to determine if the decrees are working, which allows public health officials and politicians to claim that the decrees are working if they want to pat themselves on the back, or claim that they're not working if they want to levy more. The most important aspect of this plan is to keep people afraid. If our faith is in government to give us good health, then we'll trade away anything else to keep it. We deserve a better plan than that.